I'm Dr. Dan Michaels with the Reconstructive Foot and Ankle Institute, and one of the most common things we see in our practice is peroneal tendinopathy or tendonitis. The peroneal tendons are on the outside part of the foot or the outside part of the ankle. They're often injured when you do an ankle sprain or an inversion ankle sprain. When you twist your ankle, they become damaged. And that leads to ankle instability, where when you're walking, it doesn't feel like your ankle is really solid and it always wants to turn in on you. So these tendons go on the back of the ankle and underneath the ankle, and they attach. One attaches right here, and this is the one that's most commonly injured. The other one goes over here on the bottom of the foot, but it's often torn or injured on this side where the ankle is. And so they stay kind of fixed and tight, but when you twist your ankle in, they become torn. And they don't tear like this, where they come apart. It's kind of like if you think of two pieces of linguine coming apart, splitting down the middle longitudinally. That's usually what happens to these things. And then they become inflamed and painful. And it hurts to walk. And oftentimes it hurts right here at this bone. And that's right where one of the tendons inserts. So it's attached there. So to calm this area down, like with many things, you have to let this area rest. That doesn't mean you need crutches or a special walking boot. Oftentimes, we can solve the problem with these things with a simple custom-made orthotic that goes in the foot. There's things we can do to this orthotic to make it so it rests these tendons. However, in case these things don't work, this is the easiest thing you can do because it goes inside your shoe, you may have to go into an ankle brace. And there are two kinds. One is an over-the-counter ankle brace. This one goes inside the shoe as well, but it supports the ankle and the ligaments that are around the ankle. So kind of like when you break an arm, you put a cast on, and that allows the bone to heal on the inside while the cast supports it from the outside. This tendon can be supported with an ankle brace. Now, sometimes the over-the-counter ankle brace isn't quite good enough, and it doesn't provide the necessary rest to the tendon that is required. Therefore, sometimes it's required to have a custom-made ankle brace, and this limits the motion in the ankle, which really does allow those tendons to rest. And this does fit inside a pair of shoes as well. So if you have to go to this, you need to wear this for 3 to 6 months so that tendon can calm down, after which you can go and progress to a custom orthotic device and wear that perhaps for another 3 to 6 months. If they do feel good and they support your ankle, orthotics can be worn indefinitely without any side effects, and they just make your feet feel good. And they can also prevent this from occurring again because they'll be supporting your foot. So peroneal tendinopathy or tendonitis, bottom line, you need to let the tendon rest, let it heal. Various braces can help that, followed up by custom orthotic devices. Usually the pain goes away and you never have these issues again.